Well, again, 10 o'clock every Monday from 10 to 10:30. Pop Bonds will be bringing your health or community tips for the week because we're coming every week, every Monday morning from 10 to 10:30. Health tip to keep you healthy. I want you to enjoy a long, healthy life with your loved ones. And community tip, really good information for you to have. And I've got some partners here that I always introduce. I have my integrative health partners, New Horizons Behavioral Health, and Clear Life Healthcare. And we have a special guest, a special guest that we have here. And I'm going to let him introduce himself. So I'm going to start off, as I always start, with Ms. Andrea Winston, the CEO of New Horizons Behavioral Health. Andrea.
Good morning, Pops, and good morning, everybody. Happy Monday to everybody. It's a bright and wonderful day. Glad to be here again because nothing is more important than our health. So I'm going to toss it off. This time I'm going to shake it up a little bit, and I'm going to toss it off to Reverend Clyde and let him introduce himself next.
Okay.
Good morning, Pops, and everybody. This is Reverend Clyde, Pastor Clyde with Tree Life Healthcare. And great to be back with you again this Monday morning. A wonderful show lined up for me, great guests, and talking about Recovery Rocks, and praise the Lord.
And recovery does rock. And so then when we say recovery rocks, everybody knows Susan. Let me put the guest up. I got a shirt the color of that. Mine's a little bit dark, but I like his color better. Okay. Don't lay that shirt down now, bro. Don't lay it down. Introduce yourself.
My name's Dwayne Ellis, and I'm the Peer Workforce Coordinator for the Georgia Council of Substance Abuse. My responsibilities include planning, organizing, and executing our CARES academies, our Ross CARES workshops, and other CEU trainings. And our mission at the council is to increase the impact of recovery in Georgia's communities through education, training, advocacy, and of course, peer support services. Thank y'all for having me. I'm excited.
Hey, you don't have to back up to cash your check, do you? All that stuff is over there. Susan, let everybody know who you are. They know already.
Yes, good morning. Thank you. Susan Gallagher, Community Relations at New Horizons, and I'll be behind the scenes most of the day pushing the button for the PowerPoint show. But thank you, sir, for allowing us to be here once again.
Well, what it's all about, and I had we're getting so much feedback from this program, and I'm just so happy. It's just because of our concern. The Bible says our people perish for lack of knowledge, and that's true. But knowledge is power, and you need to be empowered in so many ways, and we hope to do that in this year. 52 weeks in a year, we're going to be coming to you every Monday morning from 10 to 10:30. And so, Susan, let's get started with the PowerPoint. This is a very, very, very good topic. Recovery. Come on now, y'all supposed to say rock. Recovery.
Recovery rock.
There we go. Go ahead, Susan.
All right, so September is National Recovery Month, and we're celebrating the 31st year of a National Recovery Month celebration. And our theme here in Muskogee County at New Horizons is Recovery Rocks.
Yeah.
We want everybody to join the Voices for Recovery, celebrating connections. And the theme this year, you can see the individual strands weaving together to make a solid rope, because connections is the key to recovery. National Recovery Month is a national observance held every September to educate Americans that substance use treatment and mental health services can enable those with mental and substance use disorders to live healthy and rewarding lives. Recovery is the expectation. It's not the exception. Everybody can recover. Now in its 31st year, Recovery Month celebrates the gains made by those living in recovery. And recovery looks different for each individual. There are many pathways to recovery. So today we're very pleased to have Dwayne Ellis, the Certified Addiction Recovery and Empowerment Specialist from Georgia Council, and maybe he'll fill us in on some of those acronyms he was throwing out earlier in his introduction.
Okay, so I'm back. Thank y'all again. Thank you, City Councilman, for having me. Thank you, Susan. And again, because it's so important, I already said it once, but our mission at the Georgia Council is to increase the impact of recovery in Georgia's communities through education, advocacy, training, and peer recovery support services. And GCSA was formed over a decade ago, and about 3 years into that, CARES was formed and became the first of its kind to provide Medicaid billable services. And we became the foundation, the inspiration, and the driving force for our training initiatives. So we're similar to private and public training divisions where we've created our learning objectives within our field of expertise, which is, of course, recovery. And I'm extremely confident that upon completion of the academy, an individual that completes it will be able to provide peer support services effectively to their peer within their organization through their own lived experience, which is super important, and also be able to advocate for multiple pathways of recovery. I think Susan touched on it, but some people do church, some people do the holistic approach, some people do 12-step, some people do medicated assisted treatment. So it just all depends. And through this training initiative, we help our individuals learn to be able to advocate for their peers. And what were you going to say, Pops?
Yeah, I just like to emphasize just how vitally important peer support is, Dwayne. Just how vitally important peer support is. And you really guessed, before I even asked the question, you even answered it. It's a really vital component in recovery.
Yes, sir. Yes, sir. And I feel like there's three main obstacles a peer might face, our typical peer, and that's affordable health care, job opportunities, and ongoing peer support. A lot of the times in recovery, it's treated like a broken leg where how many times have you heard a peer go to treatment and leave and they're just thrown back into life without any resources? So our training initiative targets these three spots by shining a light on affordable healthcare opportunities, connecting our peers to workforce opportunities, and also providing ongoing peer support. And GCSA specifically, we have a warm line, so they're always able to call us 24 hours any time of the day.
That's awesome.
Yep.
So the theme for Recovery Month is prevention works, treatment is effective, people recover. And that goes back to that philosophy of recovery is the expectation, not the exception. Dwayne was a little bit modest there when he was talking about the state of Georgia and our role 10 years ago in peer recovery supports. We are the leader in the nation in peer recovery.
Wow.
There's so few things that Georgia can say we started. We started the peer recovery program, and SAMHSA has been using, SAMHSA is the Substance Abuse Mental Health Services Administration, has been using what they've learned in Georgia to roll out effective peer programs and models of recovery across the nation.
Well, that's awesome. So, Dwayne, you got to pump yourself up, pump it up.
Yes, Georgia leads in peer support services.
You're right. We at New Horizons really value the role of peers in helping us to maintain a recovery-oriented focus within the agency. And we also have, Dwayne, a peer academy that goes towards supporting our peer workforce, and that we have a dedicated person to help support them maintaining their employment, helping them to navigate the balance between being a person with lived experience and an employee. And they also provide a lot of those same resources that you described, so that we want to make sure that our peers feel fully supported within our workforce. So we're very grateful, and I'm glad Susan brought up that point that Georgia, it did lead the nation when it came to first utilizing peers and seeing the value of persons with lived experience and what they bring to the table.
Yeah,
So, Dwayne, right on, right on.
Yeah.
When you mentioned affordable health care and how vitally important it is for patient to be able to address their issues. Because we do the primary health care, but as a family practice, we see everything from A to Z. So we look at the integrated healthcare services. It's extremely important that these programs are available to our patients, and to know that the state of Georgia is a leading, has been a leader for the last, from the beginning, and to know that we have such quality of services to give and offer to our patients, because it is about just not about the physical, as we said in weeks past, but the mental, physical, and also availing themselves of programs that are going to help them in their recovery. And so thank you very much.
All right, Susan?
All right, so the next slide is about the statewide kickoff for Recovery Month. And Georgia Council on Substance Abuse is leading this. Dwayne, do you want to talk about the kickoff?
I'll talk about it very briefly. This is actually going to be my first recovery month, so I'm kind of excited. We, as people in recovery, are very resilient, and we've even been able to, jump over the obstacles that have been placed in front of us throughout this COVID-19. And, it's been a little hard staying in the house, not being able to go into public and advocate the way we would like to. But Georgia Council has been doing town hall meetings weekly, every Wednesday, talking to local legislators, different politicians. And I'm new to that whole field, but it's awesome just to bounce ideas off everybody. And this is something that we're going to continue to do during Recovery Month. So we would definitely appreciate it if everybody joined us as we continue to speak out loud about our recovery, because a motto that we live by at Georgia Council of Substance Abuse is nothing about us without us.
Ooh, ooh, ooh. Say that again, bro. Say that again.
Nothing about us without us. You can't talk about me without me being there.
I like that. I like that. I like that expression. That's awesome.
Yeah.
Okay, Susan.
Okay, so here's the information. We're asking you to join the Zoom meeting because we want you to join the Voices of Recovery, and we want to have a large group show up for this Zoom meeting. The bigger, the better. So make sure you write this information down and join us Wednesday, September 2nd at 12 noon for the Georgia Council on Substance Abuse Recovery Month kickoff to their statewide gala.
And Susan, when we get to the end of the program, when I let you know how much time we have, if you can repeat that information, I appreciate it.
Sure. One of the things that we focus on in the recovery community, and again, this is recovery from substance use disorder as well as mental health disorders. We want to have person-centered care, and we need to know that our words matter. I've been fighting stigmatizing words for over 2 years now, and this little slide shows you a say this, not that type of dyad, as far as you want to say a person with a substance use disorder, not addict, junkie, druggie. Person living in recovery, not an ex-addict. Notice that person is always first, because we want to stress the personhood of individuals. We don't want to look at them as their illness or their disorder. They are a person first. A person arrested for a drug violation, not a drug offender. One of the ones I really like is you want to say had a setback, not relapse. And a word you hear a lot that we don't want you to say is don't say somebody's an enabler. Say they are an ally for recovery. That's such a positive slant on what they're doing. They're an ally for the person working towards their recovery. And anybody want to?
Words make a huge difference. And Susan, I'm glad that you highlighted person. And that's that. A lot of times we overlook that, but that person that's in each of us really realize this is a person here.
Right.
And when I went through the slides, Susan, this weekend, that was one of the things that really appealed to me, that words do matter. Words matter.
Right. There's two. We don't want to say that a person stayed clean. We don't want to say that they have a dirty drug screen, because that implies that the person is unclean. We want to say they maintained their recovery, or they had a positive drug screen. We want to make sure that the words that we use are positive and reaffirming and supportive of the individual as they work through recovery, no matter what stage of recovery they're in.
Exactly.
My favorite one is probably the relapse and changing that to setback, because coming from a 12-step fellowship, relapse means start completely over. You haven't accomplished anything. That's sort of the mindset you get into, and a setback sort of puts me in the mindset of, okay, something slight happened and I can bounce back, and it's not, it's not that big of a deal as relapse.
Right.
I'm glad you mentioned it. That's an excellent point to mention.
Yeah.
Okay.
Okay, this slide. Here we go. Now, this slide right here, I want to say to our viewing Facebook friends, I have asked Susan and Dwayne, Andrea, to go through each one of these programs, because you know why? We are very fortunate to have programs like this here. And so even though there's a lot of them, I will ask that we go through each one and really explain what each one does. Okay, Susan.
Okay, Ms. Winston, do you want to take this, or do you want me to lead off?
Yeah, I can start. The first program is REACH, which is our psychosocial rehabilitation program. That's a day treatment for people that are dealing with mental illness. And a lot of our people come and really enjoy the recovery process that's embedded there. The next one is Generation Next, and that's for our young adults that are struggling with mental illness or addictive disease. The next program, the third one, is Emerge, which is a very interesting program that's only been around for a couple of years. And that's recognizing that when people first start to experience symptoms of schizophrenia, that's usually during young adulthood, and a lot of times it's not recognized. They may think that they're not able to make the transition between high school and going on to whatever the next venture would be, whether that be military or vocational school or college, and they think, well, oh, they just had too much stress on them. And that's a very difficult process to navigate from the family's perspective. So we're really excited to have the Emerge program to help deal with young adults that are experiencing their first episode of psychosis. The next one is our Child and Adolescent Counseling Center, which is at our main headquarters on 2100 Comer Avenue. Anything that you need for your child or your adolescent, you could come there and get an assessment done, and we will help direct you into what we think is the best treatment options for them, whether it be seeing the doctor, medication, or perhaps individual therapy. And then we have the same for the adults at the same location. And we also have an intensive case management program for adults that are struggling with mental illness that may need a lot of support in their everyday lives, and access to resources and advocacy and skills training. And we also have hospital liaison. A lot of times we find it necessary that we need to go in the hospital for a little while, just as though we were struggling with diabetes or hypertension or some other illness. Sometimes it requires hospitalization to help stabilize what's going on with us. And then once you come out of the hospital, you need someone to take your hand and walk you through what the next phase of your treatment is. And so we have a liaison that's dedicated to working with our hospitals, but when people come out, they can continue to receive support in the community. And then Susan, I'm going to let you talk about the many accountability courts that we have relationships with.
Right. Well, on this one, I was focusing specifically on the mental health accountability court, because we do have people that are in the jail and are probably in need of treatment for a mental health disorder, and they're screened and referred to the mental health accountability court. Okay, I'm going to move on to our substance use disorder recovery focused programs at New Horizons Behavioral Health. And remember, again, recovery is the expectation, not the exception.
That's exactly right.
Okay. Ms. Winston, do you want me to go on with these, or do you want to talk about the programs?
You can go ahead, Susan. I'll jump in.
See, Dwayne, I told you how they passed the baton. See how smooth that was? All right,
Now,
She tried to-
Midtown Recovery is a program that New Horizons has had for many, many years, and it offers day services for individuals in with a substance use disorder diagnosis. And depending on where the person is on their recovery, they may come every day, all day to Midtown Recovery. They may be involved in group sessions, individual therapies, etc. And they may then slow down as they work through their recovery. We use evidence-based interventions at Midtown Recovery. We use trauma-informed approach to care to delve into some of those possible ACEs that we spoke about last week that maybe lead somebody into a substance use disorder. So Midtown Recovery is a full gamut of outpatient substance abuse treatment, substance abuse intensive outpatient, SAIOP. Then we have Project Change Clubhouse, which is for our 12 to 17 years olds. And again, we're using evidence-based interventions for children, adolescents and teens that may have problems with alcohol or other mood and mind-altering substances.
And Susan, I was glad to see this. I think that Andrea last week kind of alluded to something like this here. And you want to know something? Hey, look, when you see Clubhouse, it makes these young people want to come there. You know, it's just something that to let them know that they're loved. Come here, you're going to have fun, but you're going to learn with open arms. It says that Clubhouse has such a warm connotation to it. When you say Clubhouse, we're from 12 to 17-year-olds.
Right. And the Clubhouse model is great. I mean, it has comfortable lounging areas for the kids. There's video games. There's movies. The kids get fed nutritious meals. And prior to COVID, we would take them on outings into the community, fun events and outings. So right now they're kind of limited in what they can do because of COVID, but we still focus on their recovery.
And this is the program last week, Andrea, that you alluded to, wasn't it?
Yes, sir. The premise is for our teens that recovery or the pathway to wellness has got to be just as engaging as that life was in getting high and using with their friends. So we do all sorts of things in the Clubhouse, and some of them I told them, I said, just do it. I don't want to know about it. Like midnight basketball, and you going where? They would go to Atlanta, at night, and I mean, but I understood that it's got to be exciting and engaged. So yeah.
And Dwayne, let me just tell you, when I used to work at New Horizons, she was my boss. She came up with all these good ideas. so she knows what she's talking about.
Yes.
Okay. Journey to Recovery is our halfway house program where individuals that may need extra supports around the clock have a safe place to live where they're not around individuals that are using. We also have medicated assisted treatment. Right now we're doing Vivitrol injections, which is a monthly injection, but we're soon going to be expanding our medicated assisted treatment to include Suboxone and some other proven effective interventions that assist in recovery. Dwayne mentioned that one of the three things that they're working for is people staying connected to peers. Our Connections program is a peer-led adult recovery community support program where anybody in day 1 of recovery or year 10 of recovery can come and fellowship and be around like-minded people working towards a life with no use of mind-altering substances. And then lastly, we have our accountability courts around drug usage, which would be the adult drug court, juvenile drug court, and then our civil court, which is the family treatment drug court, which tries to reunite children with their parents that may have lost them due to substance use.
And Susan, I know we're going to the next slide, but I want us to backtrack once we get to the last slide. I want us to backtrack to Midtown Recovery, Journey to Recovery, which I remember when I worked at New Horizons, and Connections. So
Okay.
just those three. When we get to the last slide, I just want to go back to those three. Okay, next slide.
So we're asking the community to join us in our local celebration of recovery and resiliency. 1 in 4 adults and 1 in 5 children will experience a mental illness during their lifetime. 21.5 million U.S. citizens 12 or older had a substance use disorder in 2019, and everyone is experiencing stress and anxiety from the COVID pandemic and its effects. So New Horizons, to celebrate Recovery Month, is doing Recovery Rocks.
Rock, recovery, rock.
Recovery Rocks.
Look. Let's get something. Wait a minute. When I say recovery, y'all say rock. Recovery.
Rocks.
There we go. That's what I'm talking about. Let's put a little pep in our step on this bad boy.
So due to the COVID pandemic, the Development Advisory Board decided that we wouldn't do the Run for Recovery. This would have been our 5th year of the Run for Recovery, but we just didn't feel comfortable inviting a large group of 300 people down to the river to participate in the Run for Recovery. So we came up with Recovery Rocks. Everybody's out walking trails and out with their family now. And so we are planting these recovery rocks that have been painted by the Friends of Art and Columbus State University art students. If you find a recovery rock and on the back of it it's numbered and has a New Horizons website and the Recovery Month logo on it, you'll win a door prize. So look for these recovery rocks from September 12th through 30th along the walking trails throughout Columbus. Find a rock, win a door prize, and keep your rock to remind you that all of us are going to come through this together. We may be together apart during COVID pandemic, but we're all in this together, and we're going to come out the other side better than we went into it.
I think this is a novel idea. People walk on the walking trails anyway. Now, Susan, wait a minute. Look, you know, you and I are tight now. So you want to kind of give me a little tip on where some of these rocks are. Come on, give me a break.
We're planning, they'll be at the, on the Riverwalk, at Flat Rock Park, at Cooper Creek, probably
I'm
at
taking notes.
Rigdon Road Park. We're going to put them throughout. I think we might even put one at the Shirley Winston walking trail. I'm not sure if that's close to your house. Maybe I'll have to plant one in your yard for you, and you can go walking around your yard looking for it.
You put one in his yard out there on the mailbox.
There you go.
I love a surprise now. I love a surprise. Let's talk about our sponsors, because, you know, unfortunately in life, nothing can happen unless good people step up to the plate and are willing to donate for a good cause. So let's talk about our sponsors.
Yes, and these are sponsors that have been with us for years. Piggly Wiggly has sponsored the Recovery Rocks, as well as TSYS Global Payments, Greystone Properties, and we also received a mini grant from the Georgia Council on Substance Abuse to help with it. Yeah, because now this year we know everybody is having a hard time. So what we've actually done is purchased the door prizes from our local businesses. We know that COVID has taken a toll on our businesses, and many of our restaurants have had to change the way they're doing business. So we actually have purchased gift cards from folks that have donated prizes to us in the past. So we've got whitewater rafting gift cards. We've got the Loft restaurant gift cards. We've got Goo Goo car wash gift cards. Fred's Tires to go get an oil change. And we've purchased these with money we've received from our mini grant and our sponsors to kind of give back to the community that's been giving to us for so many years.
I think that's awesome. Guess what? We're going to have to revisit Midtown Recovery. We're going to have to revisit the Journey to Recovery and Connections because I'm very cognizant of everybody's time. But before I leave now, I want the expression, Dwayne, you to say the expressions, the catchword that you said is it's about us.
Nothing about us without us.
Say that again.
Nothing about us without us.
There we go. That's
I
what
like
I'm
that.
talking about.
Yeah.
Let me tell you, y'all, our view, Facebook, we're cognizant of your time. It is now just a little bit past our 30 minutes, and we want to be able to have you know we start on time and we end on time. And so this is a program as the others full of information. We're just excited to get all this information out to you because you want to know something. The Bible is right. People perish for lack of knowledge. And so until next time, as I always say, please be good and kind to yourself because God loves you. God bless you now. Bye-bye.
God bless you.